The gluten-free diet is the only way to treat and manage celiac disease, but also may come with some new challenges. In this video, we are going to discuss some of the vitamins and minerals that a gluten-free diet could be missing and how you can choose nutritious foods for your child while avoiding gluten. Gluten-free packaged and processed foods like breads, pastas, and cereals can often be higher in added fat and sugar compared to gluten-containing products. This is because fat and sugar provide flavor and texture to products to replace the flavor and texture of gluten. Too much fat and sugar can promote weight gain and other health concerns in children. Gluten-free packaged and processed foods made from rice, corn, or potato are often lower in fiber compared to gluten-containing products. Fiber is important to maintain a regular bowel routine and to feed good gut bacteria. In Canada, many wheat-based products like flours and cereals are routinely enriched with iron and B vitamins, but gluten-free flours and cereals are not. Iron helps to carry oxygen around the body for growth and energy, and B vitamins support immune function and growth. Children following a gluten-free diet could be at a higher risk of not getting enough iron and B vitamins. To improve the quality of your child's gluten-free diet, here are some tips that you can try. Follow Canada's food guide as a model for a balanced plate. Try to make food at home from scratch more often than choosing pre-packaged and processed foods. Read, understand, and compare the nutrition labels when you are buying packaged food. Children on the gluten-free diet can use the Canada's food guide as a healthy plate model for their meals. The healthy plate model has half of the plate as vegetables and fruits, 1/4 of the plate as protein foods, and 1/4 of the plate as whole grains. For children following a gluten-free diet, it is important to eat a variety of vegetables and fruits to get enough nutrients and fiber. Try having a fruit smoothie with breakfast or adding vegetables to mixed dishes like soups and sauces. You can try adding fresh or frozen veggies to pasta sauces, adding fruit to yogurt, and washing and cutting fruits and veggies as soon as you come home from the store to store in the fridge for a quick snack. If your child likes dips, you could also try adding a yogurt to dip fruit into, or salad dressing, hummus, or guacamole to dip veggies into. Some great gluten-free sources of fiber include gluten-free whole grains such as brown rice, quinoa, amaranth, sorghum, and teff. These grains make tasty side dishes on their own, but you can also add them to salads and soups. Protein foods include both animal and plant-based proteins. Animal proteins commonly include poultry, beef, pork, and fish, which are all naturally gluten-free. Meat is an excellent source of iron and protein. Processed meats such as bacon, sausages, and hot dogs may be gluten-free, but have more salt and preservatives than raw meat, so try to choose these foods less often or not at all. Plant-based proteins include tofu, nuts, seeds, beans, chickpeas, and lentils. These sources of protein are naturally gluten-free and also contain carbohydrates, fiber, B vitamins, iron, magnesium, and zinc. To be sure that these proteins are gluten-free, check the label, and whenever you purchase nuts, seeds, dried beans, lentils, and chickpeas, try to visually inspect them when you take them out of the bag to look for any contamination with wheat, rye, or barley. You can try making a bean chili, lentil curry, or some crunchy roasted chickpeas for some fiber-rich meals and snacks. Homemade trail mix made out of nuts and dried fruit, a tofu stir fry, and sprinkling chia, hemp, or flax seeds on yogurt or cereal are also some delicious ways of incorporating more plant-based protein into your child's diet. Canada's food guide suggests water as the primary beverage. It is very common for children in Canada to be deficient in vitamin D because of the decreased sunlight exposure in the winter months. Vitamin D and calcium support growth and bone health. Drinking cow's milk or a fortified milk alternative like soy, almond, or coconut beverage is encouraged for adequate calcium and vitamin D. Some food sources of vitamin D include fatty fish like salmon, tuna, and sardines. However, children with celiac disease may still benefit from a vitamin D supplement in the winter, even if they eat or drink foods that contain vitamin D, because it still may not be enough. Talk to your doctor or a dietitian to learn more about a specific recommended dose. When buying packaged gluten-free foods, it is important to understand the nutrition content of the foods you are buying. One way to understand this is to read the nutrition facts table. The nutrition facts table will give you information on 13 core nutrients: fat, saturated fat, trans fat, cholesterol, sodium, carbohydrate, fiber, sugars, protein, vitamin A, vitamin C, calcium, and iron. However, other nutrients like folate are optional and not always included on the nutrition facts table. When looking at the nutrition facts table, the percent daily value column, or percent DV, will show the percentage of a nutrient. If the percent daily value is greater or equal to 15%, this means the nutrient is present in the food in higher amounts, and if it is less than or equal to 5%, then it is lower. You can use percent DV to choose the products that are higher in the nutrients you may want more of: fiber, vitamins, calcium, and iron. Try to find products that provide more than 15% daily value for these nutrients. You can also choose products that are lower in the nutrients you may want less of: saturated and trans fats, sodium, and sugars. Try to find products that provide less than 5% daily value for these nutrients. Make sure to also look at the serving size when comparing products. The information on the nutrition facts table, like the percent daily value, is based on this serving size. This will help you to know exactly how much you are eating of that type of nutrient. The percent daily value is most helpful when used as a tool to compare two different products. Let's compare two products here. Here are two white gluten-free loaves of bread from different companies. The serving sizes are very similar: 53 and 57 grams for two slices. We can see the calories, fat, carbohydrate, protein, cholesterol, sodium, and some B vitamins listed below that. Most of the numbers on the label are quite similar, so we will focus on the fat, sugar, and vitamins. The fat daily value is higher in the bread on the right, 7%, compared to the bread on the left, 3%. The sugar daily value is higher in the bread on the right, 3%, compared to the bread on the left, 2%. The bread on the left has a longer list of vitamins, whereas the bread on the right does not have thiamine, riboflavin, niacin, or folate listed on the label, so we can assume that the bread on the right does not contain these vitamins. Of course, the taste of the bread is important, but in this example, if your child likes both, we would recommend the bread on the left since it has less fat, less sugar, and a larger variety of vitamins. A children's multivitamin containing folate and vitamin D may be helpful to ensure your child meets all their nutritional needs. Ask your doctor or dietitian if your child would benefit from taking a multivitamin supplement. It can be challenging to exclude gluten from your child's diet while also striving to include other vitamins and minerals that your child needs to support growth and development. If you can, try to make home-cooked meals and snacks as much as possible. Cooking at home allows you to reduce the risk of any gluten cross-contamination, and you have more control over the ingredients in a recipe or dish. However, packaged and processed foods are normal and a staple for many Canadian families. Reading the labels when you buy anything that is prepackaged can help you compare different brands and items. By reading a label, you can ensure that the food is gluten-free and also choose foods that contain more fiber, vitamins, calcium, and iron, and less added sugar, salt, and trans and saturated fats. If you would like more personal advice for your child, please consult a dietitian with an expertise and knowledge in celiac disease.